The next speaker is going to present on I Need the Map for the Toilet. It's by Dr. Huang Cheng Hang. Dr. Huang Cheng Hang is an attending urogynecologist from the Division of Obstetrics and Gynecology, Taipei Veteran General Hospital, Taipei, Taiwan. He is very active with the society involvement, and he is also the member of Taiwan Obstetrics and Gynecology Association, Director of Taiwan Urogynecology Association, TUGA, and also Director of Formosa Urogynecology Association, FUGA. He's also a Director of Taiwan Association of Gynecology and also a Secretary General of the Asia Pacific Urogynecology Association, FUGA. Dr. Huang?
Yeah, thank you. Thank you, Chair. It's my pleasure to be here and present the topic, I need a map for the toilet. It means the OAB treatment. Ladies and gentlemen, I come from Taiwan, Taipei, Taiwan. My hospital is located north of Taiwan, over here. And my hospital, about near 3,000 beds, is a big national medical center in Taiwan. Okay. Today I will present the OAB treatment or management. Most of the cases of urinary incontinence can be simple, classified, straight incontinence, urgent incontinence, and the mistype. The SUI symptoms are urinary incontinence right at the physical activity, such as cough, sneeze, lag, or jumping. The urgent incontinence symptoms are urgency, frequency, nocturia, and urgent incontinence. If the patient have the urgent incontinence, the correct treatment of the primary first line is behavioral therapy, including pelvic floor muscle training, bladder training. The second line is medical therapy, including anti-mescaline drug and beta-3 agonist. The 2002 ICD terminology about OAB is urgency with or without urgent incontinence, usually with frequency, and the nocturia in the absence of pathologic or metabolic condition that might explain this symptom. The definition focuses on the symptom of OAB rather than on urodynamic study, and this is much more clinically useful for physicians. This is Asia prevalence of urinary incontinence among female in Asia. So you can see the Thailand about 20%, Philippines about 30%, and Malaysia about 13%. Indonesia about 5.8%, Singapore about 11%, India about 6%, and Taiwan about 7%, the Korea about 22%, Hong Kong about 12%, China about 11%. The overall about 14.6% of urinary incontinence in the population. In the Europe, patients with overactive bladder, the most common report symptom is frequency, about 85%, and heart about 50% complain about urgency. Only 36% of people with OAB with urgent incontinence. So most of people with OAB have more than one symptom. Some have 2 or 3 symptoms. This is United States, the prevalence of OAB about 16.5%. So the overall incidence in global was almost identical. The more age, the more incidence of OAB. So before you approach the patient, not only the history taking, but also you can perform breath diary. The breath diary have been referred as the last free test in medicine. It provides valuable information that can be used to determine the exact nature of the breathing symptom being described by the patient. This slide shows a typical daily breath diary. Patients should be instructed on proper use and important to evaluate their condition. The Dr. Homa comes from Japan in 2006. He launched a questionnaire about overactive breathing symptom score. He has 4 questions. Question 1 about frequency, day frequency. Question 2 about nocturia. Question 3 about urgency. Question 4 about urgent continence. So we can define the severity of OAB. If you less than 5 points, it means mild. 6 to 7, 11 about moderate. More than 12 points about severe. And then you perform the physical examination. The physical examination should include general, abdominal, including breath palpation, and the neurological examination. The physical examination should also include pelvic and the rectal examination in the woman. The physician should observe to see if urine loss occur during right at the stress on the breather. That means cough or basaba. And the lab test is also important. It's essential for the patient work up to use to rule out conditions that might be responsible for such symptoms as urinary tract UTI, cancer, diabetes, and renal disease. And the last, the blood test is also essential. And some medication can cause overactive breather like this symptom. So before you wake up, and you should take the history about the patient. Use diuretic, antidepressive, antihypertensive, hypnotic, analgesic, narcotic, sedative, and sleep drug, antipsychotic, and herb remedy. And if you make a differential diagnosis, including prolapse, atrophic vaginitis, pelvic floor dysfunction, interstitial cystitis, diabetes, and the GU tract malignancy, UTI. So the treatment including 3 parts. The first priority is behavioral therapy. The second is medical treatment. The third is surgical or modulatory therapy. So the behavioral therapy including education, time bonding, and the pelvic floor muscle training, the leg bonding, and the diet, also called behavioral therapy. So what is education? So education, you understand normal breathing function. The diary is mean you can avoid coffee, spicy food, or fruit intake. And the breathing training and breathing training is mean release the sensation of urgency or postpone urine sensation. And the time boiling is teach patient to boil at a regular interval to permit early incontinence. And the third one is pelvic floor muscle training. It's also important for straight incontinence and also for OAB. This is a casual exercise. It means pelvic floor muscle training by annoying casual. How to do casual exercise? The first one is find the right muscle. To identify your pelvic floor muscle, start urination in midstream. Then, second, perfect your technique. Tighten your pelvic floor muscle. Hold the contraction for 5 seconds and then relax for 5 seconds. Try it 4 to 5 times in a row. Third, maintain your focus. Mean for best result, focus on your tightening only your pelvic floor muscle. Be careful not to flex the muscle in your abdomen, side, or buttock. Avoid holding your breath. Instead, breathe freely during the exercise. The next one is repeated 3 times per day. So the treatment of OAB, the first line treatment is behavior therapy. You can including pelvic floor muscle training, diary, and so on. And the second one is medical treatment. The medical treatment, the mechanism is use the anti-miscarriage agent as the golden standard for the pharmacological treatment of OAB. The anti-muscarinic agent inhibited involuntary bladder contraction and increase bladder capacity, thereby relieve the symptoms of OAB, including urgency, frequency, and urging incontinence. However, some anti-muscarinic receptor agent, particularly in older women, are associated with typical anticholinergic side effects, may limit treatment, like dry mouth, constipation, or CNS effect. It's the innervation of lower urinary tract. The most 3 important nerve supply of the lower urinary tract, including sympathetic nerve, parasympathetic, and the somatic sympathetic, the somatic pudendal nerve. The central nerve system controls maturation through both inhibitory and the stimulatory signal that it receives from and sent to the bladder. The sensory afferent nerve carries signal from the bladder to the T10 to L2 area of the spinal cord. These signals are then relayed to the brain to indicate bladder fullness. Voluntary voiding involves signal from the brain to activate the parasympathetic pathway and to inhibit the sympathetic and the somatic pathway. For voiding to occur, parasympathetic stimulation of the bladder detrusor muscle may be activated, resulting in contraction of the detrusor bladder muscle, then coordinate efferent and efferent signal to the smooth muscle of the bladder neck and the urethra to inhibit contraction. The parasympathetic nerve of the left side through the neurotransmitter acetylcholine binding to M3 receptor and the M2 receptor. But the M3 receptor to promote the phosphokinase C release, finally contraction the bladder smooth muscle. And if binding to M2 receptor to inhibit adenine cyclase release, finally contraction the bladder smooth muscle. But the sympathetic nerve through the neurotransmitter of norepinephrine binding beta adrenergic receptor promote adenine cyclase release, finally release bladder smooth muscle. But in our body, the miscarriage receptor in the body have multiple area have the receptor, like in the CNS and the iris and the ciliary body, lacrimal gland, salivary gland, heart, gallbladder, stomach, colon, and the bladder. So if you block the M receptor outside the bladder, then result undesired side effects such as dry mouth, constipation, and CNS side effects like dizziness, cognitive impairment, and the effect on the stomach and the eye. No drug has shown complete bladder selectivity. The OAB drug in the history from 1960, the first launch is oxybutynin. The first drug is non-selective drug, so have much side effect. The second is organ selective drug. It's mean totalodin. It's from Pfizer in 1998 launch. The third drug is M3 muscarinic receptor antagonist, more specific for M3. So Estella not the best care of OAB drug. But if you use the OAB drug, you should be careful for the side effect, like above I told you, and you should be careful if the patient have the GI symptom, like constipation, glaucoma, myasthenia gravis, or ileus. You should be careful use the drug. In 2014, Estella also developed another new specific OAB medicine. It's Beviga, had 25 milligram and 50 milligram. So you can see the right side. The OAB treatment is not only blocker parasympathetic, and the sympathetic have the stimulate beta-3 agonist. Also, reduce the relaxation of the bladder wall. In 2017, the European Association Urology, the guideline of urinary incontinence, told anti-muscarinic drug is effective, and the mirabegron also effective, but oxybutynin may worsen cognitive function in the elder patient. So in all the elder patients in a short-term study, sulfenazine, delphenazine, physotherapy, tropine have been shown not to cause cognitive dysfunction. The level of evidence is 1. Why oxybutynin have the cause the cognitive change? Because it can cross the BBB blood-brain barrier, and so you can use the delphenazine, physotherapy, and the other medical treatment like tropine. Tropine is 4-degree ammonia, so if the large size cannot cross the BBB. The slide is very interesting about Canada in 2018. It's from Ontario. You can see the drug market. The blue line is totalodin, and the green line is oxybutynin. Oxybutynin is decreased in the market, and the totalodin in 2000 is gradually increase, and the sulfenazine is basic care from 2001 gradually increase the market, and you can see the 2014 the mirabegron is also, so you can see the drug market. And this year, May, the FDA have approved a supplementary for mirabegron as a combination therapy with muscarinic antagonist sulfenazine is being basic care. is add-on therapy for the OAB refractory to one anti-miscommunication agent. So finally, I will talk about the surgery. The first one is intestine. Intestine in Taiwan is very rare, but in USA, I can see in the Florida California Clinic Division, intestine is degrade the pastime of nerve from the parasympathetic nerve, so it can block, so decrease, but it's some for very refractory to OAB drug. The second about the Botox, it block the peripheral nerve pastime. And the degeneration also including the instrument sample technique, destruction the inferior hypogastric innervation to the bladder with the innervation to decrease sensory input. The next one is acupuncture. Also have the advantage for the OAB. So the surgery including denervation, acupuncture, and the electrical stimulation, and the next one is surgery about the cystoplasty. So my summary is evaluation of the management of OAB. The first, you should the history taking and the questionnaire, and the body diary, and the exclude metabolic or personality disease. So the first line is behavioral therapy. The second line is medical therapy, but you can combine. And the third is surgery or neuromodulation therapy. Thank you. That's my presentation.
Thank you very much, Dr. Hao.